Afternoon, this is Dr. Bhupesh from Dr. BKM Institutes. You might get a role play of this kind in the exam. So please understand, take it very easy. Obviously, there would be a lot more information that would be given in the exam. If something like this come in the exam, so this would be given. Suppose if you have to tell someone about how to quit smoking, so that would be given quit smoking, use nicotine patches, nicotine patches to quit smoking, deep breathing exercise, as everything would be given, deep breathing techniques, then also meditation, counting 1 to 10 when you feel stronger. So everything like this would be given, that how can you quit smoking. And in the last, patient has been given a task, he would always say that he is unable to give up smoking. So you have to keep insisting in a very polite manner. So if something like this come into your exam, always mention the first line. जब भी OET की speaking आपको exam में आती है, first line आपको जरूर बोलनी है, good morning, my name is BKM, I am a nurse here. हमेशा पूरी लाइन बोलनी है प्लीज. आई एम अ नर्स हियर एंड आई कैन सी फ्रॉम योर केस नोट्स. ये लाइन बहुत इंपॉर्टेंट है. फ्रॉम योर केस नोट्स दैट यू आर हैविंग हाई बीपी. सिंपल, जो प्रॉब्लम है वही बोलो. हाई बीपी, एम आई राइट, तो उसको बोलो एम आई राइट. बस यहाँ से आपका रोल प्ले शुरू होना चाहिए. इससे आप पेशेंट से कनेक्ट करते हो, वो कहेगा यस यू आर राइट. सो ऐसे आपको बोलना है. सो एक बार मैं बोल के दिखाता हूँ कैसे रोल प्ले होता है. गुड मॉर्निंग, माय नेम इज भूपेश, आई एम अ नर्स ओवर हियर. आई कैन सी फ्रॉम योर केस नोट्स दैट you are having high blood pressure, am I right? Then patient will say yes, you are right. Okay, well in that case I can see from your medical report which indicates that you smoke, drink, and you are unable to do regular exercise. So I need to ask you questions regarding the same, may I? Well, yes, nurse, of course. Okay. So first of all, I would like to tell you the risk factors involved in high blood pressure. When you are having high blood pressure, smoking, drinking, and not doing exercise on daily basis can be really challenging. It can make your condition worse. So please understand, we have to work upon these criterias, and that is why doctor has sent you to us for the advice on the lifestyle changes, so that you can reduce your smoking, drinking, and can also do regular exercise. So can I ask you some questions? Well, yes, nurse. Okay. So first of all, I would like to ask you about your smoking habit. So how long have you been smoking for? Well, nurse, it has been almost 18 years. Okay. So you have been smoking for 18 years. Could you please tell me how many cigarettes do you smoke in a day? Well, nurse, I smoke almost like 20 cigarettes a day. That is one packet a day. Okay. Well, but that is too much. You need to reduce your smoking. I know, nurse, but I can't. I can't. Okay. Don't worry. We will talk about this later on. Could you please tell me that how much do you drink? Well, it's like almost 2 packs a day after work. As my work is very stressful, I'm working as a lawyer and having a very stressful job. Yes, I can see from your case notes that you are having a stressful job and you are a lawyer. But still, drinking every day and smoking a packet a day is not a very good thing. Well, I do understand, nurse, but it is really stressful. I can't help it. Okay. So could you please tell me, do you exercise as well? Well, no, nurse, I hardly have time just because of the hectic schedule. See, Mr. John, after listening to you, I would like to tell you that you really need to modify your lifestyle. I understand that you are having a stressful job, you are working as a lawyer. I totally understand your condition and I do respect your work as well. But at the same time, now you should prioritize your health. Health is prime. If your health will be good, you would be able to do better in your professional life. Are you understanding my point? Well, yes, nurse, but it's very hard. Practically, it's easy to say that if I would be personally fine, but my work is really hectic. Well, I do understand what you mean by this statement, but I would really like to tell you that you don't have to worry too much about your modifications. I will help you how to modify that thing. As you are saying that you are smoking almost 20 cigarettes a day. So first of all, I would like to tell you that you should smoke only 10 cigarettes a day for the first week. That means you should drop your cigarettes by half. Can you do that? Oh, well, yes, nurse, I can try. Well, that's great. If you can try, if you can drop your cigarettes by half, then it is a great thing. If you can bring it to half, that would be awesome. The next week, we will try to bring it down to 5 and the subsequent week to 2, and then we will almost quit it. So do you think we would be able to do that? Well, nurse, I can drop it to 10, but I really don't believe I would be able to quit smoking because it is something that relieves my stress. Well, I understand, Mr. John. In the short run, you feel very comfortable with cigarettes because it is kind of an addiction. But please understand, in the long run, it can really spoil your blood pressure and can lead to various diseases. Please understand, you need to quit smoking. All right, nurse, I will try. Okay, that's great. Second thing is to drop your, decrease your drinking habit as well, as you are drinking every day. So I would like to encourage you to drink only once a week, and that too only one pack a time. All right, nurse, that I can do. Well, that's great. And for exercise, you need to get up early for like half an hour earlier than your work and do daily exercises. You will feel convenient. Okay, nurse, that I can do. Well, that's great. That seems like a solution now. If you can modify all these lifestyle changes, that would be great. But nurse, again, I would like to tell you that I don't think I would be able to quit smoking. See, Mr. John, as we have just discussed, that smoking is the major risk factor. So please understand that you need to quit smoking. It is really important for you. And I'm not telling you to stop it all quickly. We will slowly taper it off. This is the word, taper it off. This is the word. Taper matlab धीरे धीरे. You need to slowly taper it off. First of all, we will drop it to half in the first week, then we'll bring it to further half in the next week, and then we'll slowly quit it. Do you think you would be able to do that? Well, nurse, I don't believe, but don't worry, it will happen slowly and slowly. We will try and do that. So for the next week, can you drop it to 10? Yes, nurse, I will try. Well, that's great, Mr. John. It seems like that we have found the solution. So please be positive about it. And now, do you have any other question? Well, no, nurse. Okay, I reassured you that your blood pressure can definitely be controlled if you can control your habits and can modify your lifestyle. I have already explained you that you need to quit smoking, which we will do gradually, and drinking you need to decrease as well, and you need to start daily exercises. So I reassure you, if you follow all these instructions, your condition will improve and you will start feeling better. All right, nurse. Thank you. Okay, take care. Done. So this is how you do the OET role play. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.